Can We Afford the Green New Deal? By Yeva Nersisyan and L. Randall Wray. Universal Single-Payer Healthcare. The Universal Single-Payer System, or Medicare for All, is deemed the most expensive Green New Deal program. However, as we explain below, Medicare for All is actually a source of resources in real terms. The U.S. healthcare system is notorious for its high costs at below-par outcomes. We already spend 18% of GDP on healthcare, and that is projected to reach 20% soon. This is approximately twice as much as our peers, other rich, developed, capitalist countries, with no discernibly better health outcomes, and even worse on a number of measures. Footnote 9. The OECD country with the next highest share of health spending is Switzerland, which spends a little over 12% of its GDP on healthcare. Canada, on the other hand, spends 10.4% of its GDP on healthcare. OECD 2019. End footnote. Our excessive spending, when compared to that of our peers, can be attributed to the use of for-profit insurance to pay for healthcare, higher pharmaceutical and provider costs, and higher administrative costs. Study after study has confirmed that prices and administrative costs in the U.S. are out of line with those in the rest of the developed world, and especially compared to countries that have some type of a single-payer system. Americans do not get more health care in real terms, but they pay more for it. See Nersisyan and Wray, 2019, for a brief survey of literature. The adoption of a single-payer system, replacing for-profit private insurers, would significantly reduce the resources devoted to our unusual way of paying for health care. It would eliminate the private insurance sector's participation, reduce employers' costs of administering healthcare plans, reduce the cost incurred by doctors and hospitals due to billing insurers, as well as pursuing patients for uncovered costs, lower the costs of appealing denials, and cut costs associated with patients avoiding early treatment of diseases because of the actual or expected out-of-pocket costs that become chronic and expensive maladies. If Medicare for All could control prices and lower administrative costs, we could spend significantly less on healthcare than we currently do. While expanding coverage to everyone, all else equal, if we were able to reduce our spending on healthcare to the level of our peers, we would be creating deflationary pressures, not inflation. We estimate that in the short term, Medicare for All could save about 3.7% of GDP while providing health care to the whole population. Nersisyan and Wray, 2019. Footnote 10. Others have estimated savings from 1.58% of GDP, Paulin et al. 2018, and 4.5% of GDP, Baker 2019a. End footnote. Even if we lowered healthcare spending by 3.7% of GDP, we would still be spending more on healthcare than all of our peers. We believe our estimates are just the savings possible in the short term. In the long term, increased use of healthcare could reduce spending on chronic diseases. With universal access, cost controls, and elimination of a highly inefficient private insurance system, the single-payer system could shrink U.S. spending on healthcare by much more, bringing us in line with other rich countries at about 10% of GDP. However, for the purposes of this analysis, we will use our estimate of savings equal to 3.7% of GDP. Some will object that the savings largely accrue to the private sector, while the government will face additional costs. While it is true that the distribution of spending between the private and public sectors would change, there is nothing about government spending that necessarily makes it more inflationary than private spending, all else equal. If private spending on healthcare costs falls by more than the increased government spending, the movement to single payer will be deflationary, not inflationary. Only a net increase in demand for resources would be inflationary. And if Medicare for All is implemented as part of the Green New Deal, what will matter is the overall increase of demand resulting from all of the Green New Deal. If healthcare savings offset increased resource use in other Green New Deal projects, then the net impact of the Green New Deal will not be inflationary.